Remember this? A recognition of the hard work of NHS staff during the pandemic. But applause doesn't pay the bills, and now nurses say they've been pushed to the brink.
We need the financial recompense to keep going.
Janet has been a nurse for almost 40 years. She told me she's furious, distressed. She's going to vote to go on strike.
I should be paid enough to live on, to pay my mortgage, to go to the shops, to get food, to support my now young adult children who are finishing university. And I feel ashamed that I've run out of money, I've done something wrong. That is completely wrong.
The Royal College of Nursing is calling for nurses across the UK to be given a pay rise 5% above the RPI level of inflation. That is currently 12.3%, so the increase would be more than 17%. But in England and Wales, the average basic pay is going up by £1,400. That's just under 4%. And nurses in Scotland are being offered 5%.
Many people's pay packages up and down this country, not just nurses and brilliant people working in our public sector, but also people working in the private sector, will not be tracking inflation at the moment.
That's the government line, but the RCN say they need to make up for a decade of real-term pay cuts and fix a shortfall of 40,000 nurses.
We do not have enough nurses, and unless we pay nurses fairly, we are going to struggle to attract, and we're also going to struggle to retain those experienced nurses that we really need to keep within the NHS.
And so we could see a repeat of the strikes in the 80s, which caused disruption across hospital and community nursing.
Appointments and elective surgery could be delayed or cancelled, but nurses would still provide critical care if strike action went ahead, for example, in accident and emergency or intensive care.
Nursing leaders say they've been left with no choice. The RCN's ballot closes on November the 2nd.
Well, as you can see, Tessa joins us in the studio now. Good to talk to you. And give us an idea, when might these strikes actually happen?
Well, we should get the results about a week after those ballots close in early November. It's not a straightforward picture, though. This is being done on a trust-by-trust basis. And in order for there to be a legal walkout, 50% of nurses in each trust need to vote and 40% of those need to endorse strike action. So we could find ourselves with a kind of patchwork of strikes, not necessarily nationwide. But I spoke to someone at the RCN who told me they could, if there are yes votes, happen before Christmas. Now, this is obviously a worrying time for many. The Department of Health are urging nurses to think very carefully about patient safety, but nurses that I've spoken to say they are so worried about more nurses leaving the profession that they say that impacts safety, and they're worried patients are already at risk.